Do you feel like your eyelids have started to droop more? Do you feel like it gets in the way of your vision or just makes you look more tired than you really are? Well, there's a brand new eye drop made specifically for that. It's called Upneeq, and today I'm going to tell you all about it. Welcome to Salisbury Eye Care and Eyewear. I'm Dr. D. My goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every Wednesday at 8 p.m. Hi there, I'm Dr. D. I'm a doctor of optometry with my own private practice. I did a residency in ocular disease and now I specialize in dry eye. On this channel, I post educational videos about eye health and vision products. If you're new here, consider subscribing. Hit that bell down below so you never miss a video. I'm going to leave some helpful show notes down below today, especially regarding the physiological stuff I'm talking about. So make sure to check that out at any point during the video. Today, we're talking all about Upneeq. Upneeq is a brand new eye drop, and it's really in the ocular aesthetics realm. This drop is designed to make your eyes look more open and awake and bright looking, and that's because it's indicated for acquired blepharoptosis. So today what we're going to talk about is the drug itself, its mechanism of action, some indications, some side effects, some contraindications, and then finally we'll finish up with how you can get this drop for yourself if you're interested. All right, pupils, let's go to eye school. All right, so acquired blepharoptosis is associated with aging, and 11% of folks age 50 plus do suffer from this. To understand what that is, let's talk a little bit about ptosis. Ptosis is when your eyelid droops low, okay? So it could be one eye drooping more than the other, or it could be both eyes starting to droop a little bit. But that's what ptosis is, when you have a low-lying eyelid. Acquired blepharoptosis is when that occurs with age or over time. Some risk factors for having blepharoptosis include having had surgery, so any surgery where the eyelid muscles may have been stretched or just undergone a change basically, but surgery is one risk factor for acquiring blepharoptosis as you get older. Another is contact lens wear. So I see this a lot in my patients, especially who overwear contact lenses. If you wear contacts and you feel like your eyes have started to look a little bit more droopy, it may be because you've got some inflammation under the eyelid. There's also underlying disease that has to be considered. So when we talk about putting you on a drop for your ptosis, the most important thing is that we rule out any neurological causes of your ptosis first. So the most common reasons for a ptosis from a neurological cause would be things like Horner's syndrome. Horner's syndrome is associated with pupil constriction, eye redness, and anhidrosis. It's going to happen secondary to trauma, stroke, or vascular type things going on, vascular disease. The second neuro condition that causes a ptosis is myasthenia gravis. Myasthenia gravis can be unilateral or bilateral, meaning it can affect one or both eyes. But the ptosis that occurs with myasthenia gravis will get worse as the day goes on because myasthenia at its core is a disease that affects muscle use. So it happens with muscle use. The more you use your muscles, the more they get tired. Our patients with myasthenia will start the day okay with lots of energy. Their muscles are working fine, but their muscles are unable to regenerate their own energy, causing this like ptosis in the eyes, or they can have double vision as the day goes on. So if you're prescribing this or thinking about having it prescribed to you, ask yourself first, is my ptosis worse at the end of the day, or is it just sort of stable? The next one is chronic progressive external ophthalmoplegia. Pretty darn rare. Haven't seen this one since residency. It is a symmetric bilateral chronic ptosis with ophthalmoplegia, which is a restriction in eye movement, and it presents usually in a person's 30s, but again, this is extremely rare. It's just something to rule out if all of a sudden you've got ptosis in both eyes. And then finally, a cranial nerve 3 palsy. This is one of the biggest ones as an eye care professional that you're always watching for. It's a ptosis with ophthalmoplegia, or what that means is lack of ability to move your eyes. You can have diplopia or double vision when you have a cranial nerve 3 palsy, and a poorly reactive pupil, since the pupillary fibers do run along that third nerve. This can happen from ischemia, injury, or an aneurysm, and it is a big deal when somebody has a third nerve palsy. So before prescribing this drop, I would just recommend seeing your eye care professional and making sure that the reason for your ptosis is simply acquired blepharoptosis from age and not one of these other neurologic conditions. So let's talk about the indications. This is a newly approved drug by the FDA, and it's pretty much approved for everybody. Now, because of the class of drug it falls into, you have to be a little bit careful. If a person has blood pressure issues, hypotension, orthostatic hypertension, meaning blood pressure that changes a great deal in different positions, whether sitting, standing, or laying down. And you also have to be careful. One of the contraindications is cerebral or coronary artery insufficiency, as well as Sjogren's syndrome. So just kind of looking for those things. It also isn't going to be very effective if you have congenital ptosis. Because of the mechanism of action and the muscle that this drop works on, congenital ptosis is not going to react all that well. It also won't work very well for dermatochalasis or dermatochalasis, however you want to say it. Dermatochalasis is when you have, and it's usually runs in families, but when the eyelid skin here as you get older gets really like baggy and starts to sort of hang over the eyelid itself. It's a reason patients have blepharoplasties, and it can actually, dermatochalasis can impede a person's vision. That's something we watch for in clinic. But the mechanism of action isn't strong enough, even if it lifts your lid a little bit. If you have drooping lids over top of your lid, if that makes sense, it isn't going to be enough to lift up actual dermatochalasis. So that is a consideration as well. Let's talk about the drop itself. This is Upneeq. This is a wonderful early experience kit. We are one of the few offices to have this, one of the early offices to have Upneeq, and I'm so excited to have it for patients. But let's talk about what it is. Upneeq is oxymetazoline 0.1%. If oxymetazoline sounds familiar to you, it may be, because oxymetazoline is Afrin in a different concentration, in a different formulation, but they are drugs of the same class. There was also a Visine eye drop that was oxymetazoline, but it has been discontinued. So what is it? Oxymetazoline is an alpha adrenergic agonist. These are drugs that mimic the action of norepinephrine and epinephrine, or noradrenaline, adrenaline. What they do in this case is activate Mueller's muscle. So Mueller's muscle is one of the muscles within the eyelid. You're going to get most of your lifting action of the eyelid from what's called the levator, but the levator is a voluntary muscle. So like I can shut my eyes, I can open my eyes. Right now I'm working my levator and it's voluntary and I have control of it. But where the levator inserts, so it's at where the levator palpebrae where the levator palpebrae inserts into the superior tarsus, there's a small muscle called Mueller's muscle, however you want to say it. It's an involuntary muscle, and because it's an involuntary muscle and this drug targets that muscle, binding to its receptors and activating the muscle, you can get a little bit of lift to your lids by activating that muscle. So it works because this is an involuntary, non-striated muscle that has adrenergic innervation, and because it does, using this medication activates that innervation and causes an action. So while I can control my levator muscle, that's all I'm doing. I'm not controlling Mueller's muscle right now to open my eyes. But with Upneeq, I'm artificially engaging that muscle to give my eyes a little bit more lift. So in the case of blepharoptosis, there kind of are a few levels of that. If you have a mild blepharoptosis, it's only 1 millimeter or 2. Moderate is like 2 to 3 millimeters, and severe would be more than 4 millimeters of ptosis going on. So in the studies done for the FDA, Upneeq was shown to be clinically significant in raising the eyelid by about 2 to 3 millimeters. It's essentially helping maintain the eyelid lift that's provided by the levator and providing an additional 2 to 3 millimeters of lift. In the past, the only options we had for ptosis were to use literally a crutch, which I don't even know if I can find a picture of for you, to use tape and mechanically kind of lift that lid up, but there really aren't any good options. This is the only drop of its kind on the market. All right, so this is the drop. It is non-preserved, which you know I love, and it's designed to be used once a day. When you put this drop in, it's going to work within, the earliest is about 15 minutes. You might see a little change. And then its peak action is going to be at 2 hours after installation. If you suffer from having ptosis and you want your eyes to look more open and bright and like you're awake, this is a great drop to use in the morning as part of your getting ready routine so that your eyes just look brighter and more open all day long. Some side effects that can happen. So this does constrict blood vessels, which traditionally I've been very careful with. You know, I'm not a big proponent of medications, you know, redness relieving drops that take away, that shrink blood vessels to take away redness, because what can happen is rebound hyperemia or rebound congestion of those blood vessels and more redness than when you started. It is not an indication of this drop to be redness relieving, but I can tell you that because of the mechanism of action, you may see some redness relieving as well as the little lift you get in your eyelids. Some other side effects worth mentioning, of course, are dry eye, headache, blurred vision, or pain. Those were noted in a very, very small amount of participants in the early studies of this drug, but it is important to know about because if you start taking it and you get those side effects, you should stop right away and let your doctor know. They can also impact blood pressure. So as a class in general, because they are vasoconstricting and shrinking blood vessels, as a class, they can impact your blood pressure. And so that's why you do have to be careful if you already have blood pressure issues with this medication. When to call the doctor. So if you do have any increased redness, sensitivity to light, vision changes, or pain, I say it all the time, but RSVP is a good little rule to go by. If you're using this medication and you have those, call your eye care professional. Okay, so while not every eye care professional in the country has this medication, we all have access to it in terms of writing the prescription. However, it's only available at one pharmacy called RVL. This medication is not covered by commercial and/or government insurance at this time. It's a cash pay type of thing. We're gonna leave pricing information down below for this product so that if you are interested, you can check it out. It is a cash pay product, only distributed by basically one pharmacy. Also, at the beginning of this video, we took some footage of Kristen. You've all met Kristen before in our nighttime dry eye routine videos. She's a great sport, and so she's put this drop in today. We took some before video and some after videos. Kristen, I feel like the results are pretty impressive, and so we'll show you her results. This is an exciting drop. I love drops that are kind of in this realm of ocular aesthetics, right? I made a video about Lumify. I love Lumify. I recommend it all the time. And Upneeq is no different. I think that it's a really great thing to keep in your beauty bag or your overnight kit and use it in the morning so that your eyes look bright-eyed and bushy-tailed. And it's just a good look. Everybody likes to look awake and alert. All right, I hope you enjoyed that video as well as my little explanation of the physiology and mechanism of action of that drug. If you're a pharmacist, let me know how I screwed it up down below. I love to learn, so let me know what I got wrong. As for me, I'll be back here every single Wednesday at 8 p.m., so make sure to like, subscribe, join in, comment below, and check us out every week. I'll see you next time.